everyone, it's Karen from the Beyond IVF Baby channel. I'm so glad you're here. Well, today's topic is the unexpected events that may happen on your journey. So you probably found this channel because you're 30 plus and you are exploring your fertility options because it's not happening as fast as you would like. You're impatient, you want your baby now, and it just doesn't seem to be working out that way. So these are some of the common experiences you will experience 30 plus and also 40 plus. So 30 plus, you feel like everything should be just fine. Everything probably feels normal, not much different from your 20s. However, you don't know, but your OB or gyno knows your fertility is starting to take a dive already in your 30s. At 35, you're already considered advanced maternal age. So it's like you're a grandmother. No, it's like your ovaries are starting to become dinosaurs. So these are some things that you want to be aware of because not everyone has the same ovarian decline. Some women won't have it until their late 40s. Some will have it already in their mid 30s. So we don't know what your particular circumstance is yet, but this is what I'm going to tell you. As you hit 35, your ovulation may start to become less regular. You may still have a period because of your progesterone levels and things like that, but you might not be ovulating. There are all kinds of circumstances in terms of what could start to be going wrong. In another episode, I'll be talking about supplements that can help you, the ones that I found that were helpful for my situation. So, what you might be experiencing, you might start to be feeling a little bit more tired, you might have a little less energy in your mid to late 30s, but nothing that is really causing probably significant issues that you would go see your doctor or you'd be like, dang, why is this going on? So in your 30s, you're starting to try and maybe it's just not happening. And you're going to start the long journey to what are my options? Do I want to try an IUI? Do I want to try timed intercourse? What exactly do you want to try to do given your budget and your partner and all of these things? So first things first, things aren't happening naturally. You can do a couple of things. You can start to take your basal body temperature early in the morning. That's something that I did. It's very cheap. Those thermometers are less than $10 on Amazon. The next step up is some kind of app in conjunction with what I used. I don't know what the replacement is. If you would care to share the details of the newest, latest gadgets, feel free to do that. But back in the height of my journey, I was using the Clear Blue Easy Fertility Monitor. So you would get your fertility test sticks and it would basically track you in terms of, is this, a good chance of getting pregnant? As in you have a high or a peak, or are you at a low chance of getting pregnant? So that's helpful. It's kind of eye-opening and can give you an idea if you are ovulating regularly or if you consistently get the same numbers without variances. You definitely want to see your OB and do some blood testing, especially for the progesterone, to see if you are actually ovulating. The doctor can also take a look at your follicles to make sure they're growing, because from the follicles is where you will ovulate one of your eggs. So let's go on ahead to your 40s. So in your 40s, so many different things are happening, a lot more changes. They do say the biggest changes are in your 30s, but in your 40s, like by 44, you have your next really big significant decline with the amount of eggs you have, the quality of eggs you have, and all of those things. So you might notice changes in which you're tired, you're having a hard time sleeping, you might have some perimenopausal symptoms happening already. Doesn't mean you can't get pregnant, but it's probably going to be more challenging for you. So what I would recommend, by the time you are in your early 40s, you want to make sure, if you haven't done a workup with blood test and or an ultrasound just to check to see the amount of follicles you're getting and things like that, you want to do that. You also want to make sure your partner is getting checked too. Don't be like me and go through every single test there is and then finally 2 years later finally get your partner to do their sperm analysis, because I know for me, we lost a lot of valuable time because we held off on testing him. And guess what? At that particular time, he was a much bigger component to he was the complete component as to why I wasn't getting pregnant. Let's be honest. At that point, that was the complete picture why I wasn't getting pregnant. Once we corrected his issue, then I started getting pregnant. Okay, so I digress. Back on track, 40s. You're going to start to experience changes. Not every woman will have extreme changes, but you're going to at least notice subtle changes with your cycle, with how you're feeling. Your energy, you'll probably feel it decline. You might decide this is a time you're going to start to drink coffee. That was me. It's like, okay, let's see how we can boost our energy. I noticed I wasn't as effective in the gym. Why? Because by the time I finally got to the gym, it was after work and I was tired. Hello. So the energy I had was going down. My sleep quality was poor. My diet wasn't ideal. Now, I had a lot of whole foods and organic items in my diet. However, I had a lot of snacks in my diet and sugar, which definitely was not helping my situation any. So I would recommend looking at the different fertility books. I did a review on some of the top books you can read when you're starting your fertility journey to help support you. And I think really this is something that's going to be very helpful. So your energy is going to go down. You're probably going to feel more tired. You're probably going to be more moody. And this all, of course, is going to take a toll on your relationship, on your relationships in general, as well as your partner. So for full disclosure, let me tell you, while I have a beautiful toddler, she is 1.5 years now, the whole process of my fertility journey, remember, it spanned over 10 years. Yes, I had breaks in between. I'm getting divorced. It just became too much. The relationship, it just took its toll. And when you add a little child into the equation, one person can't be doing it all. So basically, for me, we're getting divorced. Now, you have to expect there has to be give and take in a relationship. If your needs are not being met, you have to make those decisions. But let me tell you, had my journey been easier, let's say I got pregnant right away, or let's say I got pregnant after just 2 or 3 years of trying different options, maybe we wouldn't have gotten here, or maybe we would have gotten to this place a lot sooner. But keep in mind, the fertility journey it takes a strain. It's difficult. It's difficult for you. It's difficult for your partner. It's difficult on all your relationships. So for me, while I have the joy of my life, my beautiful daughter, I'm in the process of getting divorced. And it's something that I ultimately decided was going to be the best for us. But I want you to be aware. At what cost are you going to have your baby as you continue to try? So just keep that in mind. There are sometimes, unexpected curves along the journey. I didn't necessarily expect that I would be getting divorced so shortly after having my baby. Again, will be less than 2 years, and we'll probably be divorced by that point. So Keep your head up, be strong. Let me know what you're interested in hearing next. Little by little, I want to divulge my tips and how I feel I ultimately was successful on my journey. And until then, if you could give a like and subscribe, and also if you have any questions, ask a question. I'd be happy to do my next video and address that for you. So until then, ta-ta, and I will see you next week. Ciao!